Hi, my name is Lisa, and I'm doing my current events presentation on an article from the Washington Post this year, September 10th, 2017. The title of the article from the Washington Post was that she rejected chemotherapy and chose to die of cancer so she could give birth to her child. The story was written by Christine Phillips, and the story goes that the mother's name was Carrie. She was a 37-year-old mother of five who developed headaches in March. She wasn't really thinking too much about the headaches until that she started vomiting with them. She then went to the ED, had a CT scan. When they did the CT scan, they found that she had a brain tumor. They then did a biopsy and found that she had a glioblastoma. In April right after that diagnosis, she had surgery to remove the tumor. The husband says that not long after that, she went home and she went back again because the tumor had returned. This time, the tumor returned, and they found out that she was 8 weeks pregnant. So the doctors gave her two options. They said that she could do chemotherapy to prolong her life, that she would, if she was lucky, she would have about 5 years to live. But if she wanted to do that, she would have to terminate her pregnancy. And the other option was no chemotherapy, and then she would die very soon, much sooner than she would if she had the chemotherapy. But she would not have to terminate her pregnancy. The wife and the husband decided that it was a difficult decision, but for them it was an obvious decision. They were firm believers in the pro-life movement, and they did not want to terminate the pregnancy. They told the doctors that she would not go through with chemotherapy, but she did have the surgery. So they did the surgery, removed the tumor, and she did go home. By the end of June, the tumor had come back again. They rushed her into the hospital at the end of July with severe headache, and she was having seizures continuously. She lost consciousness during that time and never regained consciousness. Apparently, she had a massive stroke during this time with severe increased intracranial pressure. She was 19 weeks gestation. Doctors acted compassionately and said that they would do what they could to keep the life of the fetus. But Carrie, they said, would probably never wake up again or never regain consciousness. So she was kept alive on a ventilator and with feeding tubes. 2 weeks later, she had another stroke, and they needed to do a craniotomy, which is removing part of the skull to relieve pressure on the brain so that she wouldn't herniate and die. 2 weeks after that, the baby was not moving in utero. The husband decided to do a C-section, and the baby was born, 1 pound, 4 ounces. They removed Carrie from life support after that, and she died a day or two later. Some critics questioned the decisions of the parents to not treat her with chemotherapy to prolong her life so she could be with the kids that she had for maybe 5 more years. So I think the primary ethical principle that could be considered violated in this would be the principle of beneficence. Although I believe the doctors gave the mother good choices and acted on her behalf. Paternalism is something that was very popular in the past, that the doctor's always right, the doctor has superior training, knowledge, and insight, and is in an authoritative position to determine what is best for his or her patients. We no longer go by that theory as much these days. But the doctor in this instance showed discernment and informed the mom of her choices and respected the mom's right of autonomy. According to Beauchamp and Childress, to respect autonomous agents is to acknowledge their right to hold values and to make choices and to take action based on their own values. This is very important in this case. According to the Code of Ethics of Nursing, the duty of the nurse is to respect the patient's self-determination. However, while doing that, as nurses, we should assure that two conditions are met so that we can determine that the decision is made autonomously by the individual. One is that the patient receives adequate and accurate information, and two, the decisions are made voluntarily. There's a lot of information in the text about this, about how much information they do not feel patients need to receive or understand information as well as the doctor or nurses would, but they have to have an adequate and accurate information that's given to them before they can make a decision. And their decision needs to be voluntary, so they have to be able to have the ability to make a decision and not be impaired mentally or physically, or coerced by a family member or the doctor. So that's one of the important roles of the nurse in this situation, is to make sure that these two important conditions are met when you're respecting someone's autonomy to choose. And I think in this situation, those were both met. I think the mother had the ability to make a decision, and this was her choice. And I believe that she did it from her own beliefs and values, along with her husband, and that she wasn't coerced by anyone. But some of the implications for healthcare that are brought up by actually someone else had brought up that I didn't think of were areas of cost containment. So if a patient is not going to recover, a mother is not going to recover, and she's pregnant, should we prolong their life? And for how long? For how many months on life support until the fetus is viable? So the question becomes, what about a mother who's brain dead, or there are other issues? What if the infant dies anyway? So these are questions that I think some people could bring up that have to do with cost containment. The principle of respect for autonomy is a prima facie obligation. And as long as no one else is harmed by this decision of the mom, then her decision should be upheld. And in this case, her decision was upheld.